Perfect Learn TV. We all know that gender-based violence could be on these different forms, but I was just caught by FGM, or female genital mutilation, which is not practiced or not common here in the Philippines. Also the honor killings or honor-based violence, as well as the new one, the cyber violence. Now, during the 2014 Europe-wide survey result of the European Union, they found out that since the age of 15, 1 in 3 women has experienced physical or sexual violence. 1 in 2, on the other hand, experienced sexual harassment. 1 in 20 has been raped, and 1 in 5 women experience stalking, and 95% of victims trafficked for sexual exploitation in the Europe are women. Now let's see how the survey changed for during the new normal or with this pandemic. There is 10 to 50% increase in domestic violence as helpline calls recorded in some countries. 3 times increase in intimate partner violence in China. And there is 92,000 child abuse in India, 10 times increase in abuse and neglect of older people in some setting. Now, why the COVID-19 pandemic, the lockdown, as they assess, caused the high rate, the high number of reported incidents of violence against children, women, even older people during COVID-19 pandemic. They see the disproportionate and burden, or the disproportionate task and burden on the part of the women in terms of homeschooling and taking care of the sick at home. They also the stay-at-home orders may have increased the frequency of demands for sex from a partner, and thereby also increase the risk of sexual coercion or unwanted sex. The telephone ownership or internet access may be limited and monitored by the partner, as well as the financial dependency of women to their partners. According to a study in Canada, 1 of 3 women are subjected to unwanted sexual behavior in public areas. 2/3 of young women in India, adolescent girls and men, feel the rural village public places or spaces unsafe for women after dark. In Cuenca, Ecuador, 90% of women living in urban areas have experienced some form of sexual harassment in the last 12 months. And in the European Union, 1 in 10 women have experienced cyber harassment since the age of 15. Now, this is in terms of violence in public spaces in relevance to the current setting, COVID-19 pandemic. Now, what is the worldwide response of both the World Health Organization and the United Nations on addressing this gender-based violence? So talking about the World Health Organization, it has already included or have taken its part to Sustainable Development Goal number 5, particularly the 5.2 SDG on elimination of violence against women and girls. I mentioned a while ago a form of violence against women, the female genital mutilation, wherein part of a woman's genital is removed during birth or not removed. They even closed particular opening on the female genital as part of their culture, believing that this is socially accepted. But in Somalia, health workers, girls and women, are experts already in preventing female genital mutilation. We have seen here the importance of gender training in order to make gender, particularly women, aware of violence and how they will protect themselves from it. It is surveyed that there are 2 million, more than 2 million women who have experienced the FGM. and millions of girls and women around the world are waiting. There is also a study, a so-called new approach to FGM. It is said to be a hybrid, effective implementation of a research study protocol targeting two levels. The first one is the antenatal care training, wherein the group of these researchers will provide FGM-related clinical guidelines and handbooks, as well as anti-FGM policies and posters. These are in Guinea, Kenya, and Somalia. And then at level 2, they will target the person-centered communication, not only the training, but the communication, focusing on challenging the female genital mutilation-related attitudes, and build their communication skills to effectively provide FGM prevention counseling. Aside from that, the World Health Organizations, in order to protect women and children from violence during the COVID-19 pandemic, encouraged the governments to include violence against women essential services in COVID-19 emergency preparedness and response plans, and also provide support such as hotlines, shelters, and other specialized services to provide services in the context of COVID-19 prevention measures to women and children. Also, the UN Women proposes that local leaders in responding to COVID-19 can secure resources, get the message out, and ensure safe spaces for women. Thank you for watching. Please subscribe to Perfect Learn TV for more videos and updates.